Hello, good day. Welcome. My name is Michele Floriani. I'm the Chief Marketing Officer at Sequoia Consulting Group. It is always my pleasure to host you all on our ongoing series for the return to work. It is a great webinar today. I'm excited to share it with you. Let me kind of get us going on the content today, set it up, do some announcements, and then we'll get into our panel discussion. As always, I'd like to remind people, the folks we have today, particularly today, they're clients of ours, they're professionals in their own field, but they're not experts in this particular topic. It's always important that you consult your legal and tax and other kinds of professional advisors as you make your decisions in your path forward. But so grateful for the panelists that we have today and Roland and the team to kind of talk through some of their experiences to date. So we'll start again with some opening remarks and some quick announcements and updates. Then we'll get into 5 lessons. I'll tee that up in a sec. Finish with a little bit of product updates for those of you who've been following along and want to know where we are in terms of what we're focusing on right now with the Return to Work Center product and what's coming next. And then we'll close with some remarks. So again, you're in participant mode, listen-only mode, of course. Use the questions. Obviously, we're going to unpack 5 questions through with panelists today. But if you have a question that comes up and we have our eye on it, we'll try to feed that into the discussion. And if we can't get to it today, we will certainly take it, try to get you an answer or address it in a future upcoming webinar. So again, thanks for being here, for being part of the ongoing discussion. Let's dig in with some announcements. Just want to make sure everyone saw it. So thank you to the many of you who participated in our recent survey around supporting parents. Got 513 companies weighing in on different techniques and ways and considerations for trying to do what they can for certainly young and old parents with kids right now. It's a very challenging time, taking care of people as they both work and balance personal lives. And so check out that report if you haven't. It's in our resources section on sequoia.com. A lot of good nuggets. And again, thank you to our community for participating in these surveys. It takes your participation to make these products so valuable for others. So appreciate that. So as you can imagine, as we've been going along this series, we've get continuous inquisitions and requests to check out the Return to Work Center. And so what we decided to do is to set up a kind of weekly demo that's designed to be a very low stress, easygoing product demo on a regularly scheduled time that anyone can just show up and kick the tires, check it out, ask some questions and go. It's run by some of the people you'll hear today and by the Return to Work team. It's very, again, it's there as an easy way for anyone to get a much closer look at the software solution. So if you're interested, you can get to it from the Return to Work Center on sequoia.com. Highlight that little line right there underneath the sign up button is where you can actually go and you'll be brought to this page and you pick a date and a time and then go. And then of course, if you want your own custom tour, we'll have you give that as well, but this is just an easy thing. I want to make sure everyone's aware of that. And now let's pivot into our topic today. This whole webinar series has been about the path forward, and we've looked at all sorts of angles. We've looked at the legislative angles. We've looked at the angles around culture. We had the extended work from home themes. Regardless of what angle we have for the webinar, it seems to always involve this intersection of a lot of complex topics like culture and people and policy and managing the balance sheet, the facilities, the buildings. And today is really cool because we've brought together 3 companies who are not only 3 different kinds of companies, but also 3 different roles in those companies to share and express some of their lessons learned and some of their color commentary on the 5 topics that we want to unpack today. So again, Colin and Cassandra and Ben and Roland, who's going to be our moderator for those discussions, who leads the Return to Work program at Sequoia. Thank you for being here today. You'll get the chance to meet them and hear from them in a second in much more detail, but so appreciative of you spending some time with all of us today and being part of this discussion. I wanted to invite up Roland Ho. Again, in addition to being the VP of Data Science and Analytics, he's the program leader for the Return to Work Center from Sequoia. He's been involved in so many of our clients. A little over 60 days ago, we started the path forward with some of our clients in the Return to Work Center. It's led to countless hours of discussions, sitting down, planning, ideation, a lot of different considerations. And what we've learned is actually there's a broad range of paths for, and a lot of it has to do with companies' culture, their business models, their facility scenarios, and really a lot of times their values and their philosophies about how work gets done. And so with that, Roland's been kind enough to be our host today as we go through the 5 lessons. So without further ado, Roland, I want to turn it over to you to set us up and take us through here. Welcome.
Great, thank you, Michele. I am super excited for our panel today. We've got some great folks joining us for this discussion, as Michele noted. Colin Higgins is CEO of Summitry, a financial services company based in the Bay Area. Cassandra Pratt is Senior Vice President of People at Progyny, a fertility benefits company based in New York City. And Ben Buenaflor is project lead for Return to Work at Roblox, an online gaming company based in the Bay Area. So thank you all for joining us today. So let's hop in here and talk about the top 5 lessons learned from bringing folks back to the office. All right, so next slide here. All right, so our first topic area is really around this question of, does interest in coming back to the workplace translate into actual usage? Like, do people come back? Next slide. And just as context, so employee surveys that folks have been doing indicate many employees are interested in coming back to the office. This can be due to a variety of circumstances, right? Maybe it's somebody with a lot of roommates all jammed into some very small apartment trying to work on top of each other, to maybe someone's home doesn't have really good internet connection and you can't really do all day Zoom calls really effectively there, to those with families who might have several kids and several pets all jumping around all around all day, and it's really distracting and hard to focus. And on the employer side, employers really want to be supportive of their teams, right, and provide an office environment for those who need it, as well as re-enable in-office collaboration and innovation for the longer term. Right, and so I'm going to turn this first question over to Cass here. Would love your thoughts on this question of how many people actually show up to the office once they're allowed to come back in voluntarily.
It was an interesting process. We actually did our first survey back in, I'd say mid-April, and then did another one in May as we were trying to prep for this. And as Roland said, we're based in New York. Our only office is in New York. So it was a little bit easier for us knowing that there's only one office location that we were going to open. And we had about 20% of our employees that we surveyed say they wanted to come back. And we were trying to balance that, knowing there were a few people we were also going to ask come in for some critical projects. And we had to keep our capacity at 25% or less. So we were doing a little bit of scrambling, thinking we'd do phase 1 with the critical people and maybe a few of those that had requested, and then we do a phase 2 and allow a few more, maybe rotate schedules. Well, when we announced that we were going to actually open on July 13th, the volunteers dropped significantly. We only had one of the people that had had said they were interested in coming back in a survey actually come back in our first week when we were here. And there were a variety of issues, anything from childcare and not being able to come into the office at that time. I think the other issue that came up for a lot of people is, you kind of want to wait and see what's going to happen. How many people are going to come in? Are you going to see more cases of COVID in New York City? Are there going to be issues with transportation? How are people going to abide by, the different office protocols that we're putting in place? I'm actually talking to you from my office. But we only ended up with about 10 people in that first, I'd say 3 weeks. And then we had a couple more people return. Now, I will say as of the beginning of September, about half of the initial individuals that were interested are now here. They just wanted that wait and see. They also wanted to get childcare lined up. So once they were able to take care of some of the other personal items, they were ready to come back. And we have seen once someone comes back and they get comfortable in the new normal, new office environment, they're typically here for 2 to 3 days a week. And that's actually great for us to see, because at some point when we are having more people come back, it would allow us to do different schedules and shifts if we have one set coming in for 2 days and another set for 3 days. But I think one of our biggest learnings from all of this was keeping conversation and the dialogue going and being very open, because it is a fluid situation. People's home lives are changing a lot. So they may be ready to come back, and then all of a sudden, you know, school is remote again, or somebody in their family may get sick, and it might not be COVID. It could be the flu or a cold, and we still want those people to stay home. So I think it is really critical that not only are you sharing company communications, but talking to employees one-on-one to see how they're feeling about coming in, or if they're here, how are they feeling about being here? Because it is never exactly as you planned, which is what we found out.
Wow, thank you, Cass. That's really, really incredible, you know, really helpful to hear your experience and kind of what happened between what you saw in the surveys and then what actually transpired, and just how long it took for people to get comfortable. Let me turn it over to Ben here. You know, would love to, you know, hear how your experience at Roblox compares. I know Roblox also had pretty substantial interest initially based on your employee surveys.
Yeah, no, thank you so much, Roland, and thanks, Cass. You know, similar to Cass, we really had a plan to do it in phases. And lucky for us, you know, a majority of our employee population, around 90% of us, are residing in the Bay Area. So a lot work off of our San Mateo headquarters. So, you know, similar to Cass, we had that strong initial desire from our employees to really utilize our office. You know, like Roland mentioned earlier, our, you know, company really thrives on that face-to-face interactions and in-office collaboration. So as a result, a lot of our employees reached out to us. They were pushing for it. It was community driven, which is a value that Roblox has. And they said, hey, you know, I'm working in not so ideal working conditions. You know, I have pets jumping off of kitchen cabinets. I have kids running around. I have, you know, a lack of central air during heat waves. And really the list went on and on, you know, and as, you know, an HR team, we really had to be proactive, right? So we wanted to give them that flexibility, the resources and the support, and make sure that they understand we're not mandating them to come back. Actually, a note that we had was we told senior leaders and we said, hey, you know, we really don't feel comfortable having the senior leaders work out of the offices, because we don't want the employee population to feel like, hey, my VP is working out of the office, maybe I should too, right? So we really wanted to engage the leadership team there and say, hey, you know, the optics of you coming into the office has downstream impact, and really, you know, make them aware of that. So here, you know, as a growing company of around 800 employees, 20% of our employees, so around 160 of them, signed up for our initial training course or training kind of PowerPoint, where we walk them through the, you know, RTW tool. We walk them through what steps they would needed to take if they wanted to utilize the office. And of that 20%, we only saw a small fraction of around 15 employees actually go into the office. And this includes, you know, mandatory, you know, kind of quote unquote mandatory employees like facilities and IT, who, you know, logistically would attend or go to the office anyways. So for us, interest didn't translate into actual demand, but based on that feedback that we got from employees, really the two biggest hurdles, which we'll talk about later on in the webinar, are really around COVID-19 testing and transit logistics, which is in the agenda. So super excited to touch base on that, you know, once we get there. So thank you so much, Roland.
Great. Oh, thank you, Ben. Yeah, that's very, very interesting to hear, how community driven it was, and then the thoughtfulness around, making sure that, you think through if the leadership's there, then that kind of sets the tone for the company and what implication that has. So really, thank you very much. Colin, maybe, a couple thoughts from your end as well, like how did things go for Summitry, and, and where are you at today?
Sure. So not too different, I think, experience from Ben and Cassandra in that we did an initial survey. We probably had about a third of the firm that just indicated an interest to return. And then when it actually came time to go into the office, we probably had about 70% of that. And so it was expression of interest was there. We made it completely optional. The first couple of weeks, people did show up, but then what we realized, since we did make it optional and we weren't explicit about, coming in for the entire week, people would start coming in 2 days a week or 3 days a week. And so really we had to, as a leader of the firm, I had to sort of adjust my expectation of, okay, just because there's interest doesn't mean that they're going to be there the entirety of the duration of the week. I will say one of the challenges that we had is, since we were in San Mateo, and Ben probably experienced this at Roblox, is that we were able to go in for non-essential work in the office, and then that worked for the month of July, and then the San Mateo ordinance basically reversed course and we were no longer allowed. So we had to do a total pivot. So we had that 1 month in to experience it. And I think it was a great first step for us, but there's still a lot of learning for us to do going forward.
Terrific. All right, well, we'll need to move along a little here to stay on track. So let me quickly summarize, some of the key takeaways we heard. All right, employee surveys, having at least, 15, 20% of folks interested in returning, the actual number of employees that show up in that first week can be as low as 1. And so, definitely only a fraction of those, but that slowly builds over time, right? And then, this idea of not everyone would necessarily come in every day. And so, if you have like logistics and, management around like having PPE supplies or, having, folks ready to receive people at the door, probably getting a 1 or 2 day lead time, right? Heads up on if people are coming in is definitely very helpful for scheduling and planning. All right, let's move on to the next item here. So lesson number 2, common challenges to accessing symptom-free COVID testing. And this, for this question, Ben, I think you had mentioned that this is something that, your folks have, run into. A lot of employers are requiring upfront testing prior to a return to the workplace. And yet COVID testing locations and sites all have like slightly different rules, right? And they continue to evolve very rapidly. And then it's layered on top of that, many health insurers may only cover medically necessary testing, right? Like if you don't have symptoms, you don't appear sick, you don't have a clear, like I was in contact with someone who was COVID positive, a lot of insurers like that's convenience testing and they may not cover it. So really, question here is, how have employees fared in trying to navigate these hurdles? I'll turn this one over to Ben first.
Thank you so much, Roland. I really want to start off this session by embarrassing Sequoia a bit. I want to give you guys a huge shout out to the Sequoia team, since one of the biggest lifesavers in the Sequoia Return to Work tool is actually a very well-maintained list of Bay Area COVID testing sites. So under that resources playbook section of the app, you'll find those resources. So we found that this was such a great resource. We started by sharing this out to our employees during the training phase, which really organizes all of the popular and kind of well-used testing sites throughout the Bay Area, organized by different counties. So huge thanks again for them. With that said, from this playbook, we found that when we introduce employees to programs like Project Baseline, which provides no cost testing without restriction and without insurance, these are the great resources that, our employees really utilize. So I know one of the questions from Edmund Chang was talking about the testing policy that I see in the chat. So this is a great starting point. I know that they're around 15 states. And really it expands the access, right? So you don't have to, have any symptoms to overcome that challenge of accessibility. And, speaking of that issue of accessibility, we also kind of struggled with the turnaround, right? The turnaround for the testing results. So luckily we partnered with a local urgent care site, so Dignity Health via GoHealth. So that provides our employees with same day 30-minute test results. So even then, right, this was limited to only certain employees under certain plans. So for example, Kaiser would have to pay out of pocket for Dignity Health. So we worked with leadership to really ask ourselves, how much are we subsidizing this? And I think that's a question that, everyone, as part of this discussion needs to ask themselves, right? Do we subsidize this kind of symptom-free testing? And really what we learned from this was it's best addressed locally. So, on the Sequoia Resources app, they have testing sites for the Bay Area, for Southern California, as well as New York City. But it's really reaching out to your community and asking, hey, what are the local programs and projects and organizations that have easy access and, reduce those burdens for our employees? Thank you, Rowan.
All right, thanks, Ben. Yeah, no, super helpful to hear some of those challenges and how you overcame them. Colin, curious to hear from you. For your team, like, was testing a challenge? How did you all solve that?
Yeah, and I'll just reiterate Ben's kudos to you all on the sort of the availability of information in terms of testing sites that was great for us, and the flexibility that it provided. We've got employees dispersed all over the Bay Area, and so a testing site in San Mateo might not work for a majority of our employees. They might have to go to Fremont or the South Bay or up here in the city, and so just having that flexibility was great. The challenge that we ran into, we did a cohort system, so we basically divided the firm up into a third, and we would be in the office for 1 week and then 2 weeks remote. And so the idea being, if there was any sort of positive symptom, that we could isolate that entire team and not disrupt the sort of the flow of the work environment. The challenge that we had was, and this was back in the summer when I think peak testing and peak sort of caseload, it was a time factor. So we would get anywhere from, I think the quickest we got a test result back was in 2 days. And then there were other employees that was 12 days. And so that sort of blurred that ability to come into the office. And our mandate was you have to get tested before you come in. And then realizing that, wow, if I don't get my test result, even if I'm prepared well in advance to get my testing during my remote home period, they still weren't, some of our employees still weren't getting that test result in time. And so they had to stay back. So testing has advanced tremendously since then, but I would just say it's the time lag indicator, the time lag of getting that result back in time to sort of get the free and clear, go back to work.
Great, thanks, Colin. And then Cass, I know you're located in New York City, all right? And like New York has, I think, a very different environment in terms of testing availability and cost.
We do. We also used your resources, although we were at peak time too. It seems like right after the July 4th holiday, return times for testing results just went from maybe 3 or 4 days up to as much as 2 weeks in some cases. And we had people try everything from their own doctor's offices to a city MD. We actually spoke to a couple of groups to try to contract and have them come on site. One of our biggest challenges is we are small. We're only about 200 people total. And we were only looking to test about 30 people. So having somebody come on site, it was just not logistically possible. And so what we were able to do is reach out through one of our investors who also had been one of our PE firms prior to going public. And they had set up basically like Sequoia Tech's pool for benefits, a pool for their portfolio companies needing testing so that they could contract directly with one of the major lab providers. And now all of our employees get tested every 2 weeks. So we have 2 cohorts. One gets tested 1 week, next the following week. And the results come back in 72 hours, which is great. But it was difficult at first. It was quite a bit of back and forth and waiting and people getting retested and not coming in because by the time they got their results, they were sort of out of date.
All right. Yeah, no, it's definitely a big area that we're all going to have to solve. Like right now, not that many people are getting tested, and in the future, we might need a lot more testing. But let me summarize real quickly. The COVID test availability and eligibility criteria can be a bit of a maze for employees to navigate. And in a lot of places, insurance coverage, may not cover symptom-free testing, right? And so having clear guidance for your employees on where to get tested and how that testing interacts with their health insurance, is really valuable to reducing confusion as people are coming back to the office. All right, so let's move on to our third topic here. We'll pick up the pace a little bit. So open reservations versus cohort system. What's the norm? All right, and so, context here, open reservations process where employees can just go ahead and, kind of pick flexible days to come in. Today's, this week, Monday, Wednesday, next week, Thursday, Friday. That's the most flexible, and adaptive. But having cohorts, provides better separation of team members and better contains the impact, should any COVID positive employee accidentally come to the office unknowingly, right? And so the question here is, how are companies, thinking about the, balance between that flexibility of reservations versus the greater protection offered by cohorts? And so, let me turn this over to Colin first, get your thoughts. I think you said you started with the cohorts process. I'm curious if that's evolved since then.
Yeah, so we maintain the cohort process. And I think what we did is we looked at the survey results and determined those that expressed interest to return. That gave us a real good insight into how we could actually define the cohorts going forward. And I think the key too was also having that flexible, that 2 weeks of remote versus the 1 week in the office. And a lot of people, just to get more clarity, I think at the end of the day, from a leadership perspective, it's just you want to give the employees, the staff, the team as much clarity as possible with as much lead time as possible, so they could plan their, plan their childcare, plan their activities around that cohort process, as opposed to sort of the ad hoc nature of just an open reservation system. And also the cohorts allowed us to put people in, we're a team-based company, and so making sure that we had adequate representation amongst the team as defined by the cohort, that just helped us a lot in terms of our planning and continuity of our operations.
Great. Cass, maybe get your thoughts here on a similar idea. Like I think you all may have evolved a little bit between cohorts and reservations, and kind of take us through a little bit of that thought process and where you're at now.
We started with cohorts. I think part of that was initially thinking more people were going to come back, and for exactly the same reasons that Colin talked about, giving people the structure, being able to have teams on site together. We started out with 3 different cohorts. What we found is not everybody in those cohorts was coming in every day, and that was actually fine based on the structure of our business. And so we have recently moved to reservations so that people could come in Monday and Tuesday and they coordinate with their team. And then the next week they might be in Thursday and Friday. So luckily the amount of space and the structure of what we do allows us to have that flexibility. At some point that may also evolve back to cohorts if we need to have more people come in or if more people express interest, because there's certainly value in being able to separate. But we're trying to be as flexible as possible to make it easy for people to come back. And also to give them the comfort level, they're not locked in. It's really critical for us to know who's on site every day, and the reservation system allows us to do that. So it works out great. We're happy to have it evolve a bit as the situation keeps changing.
Okay. Yeah, no, that's very interesting, right? I think there is this pendulum that's going to swing a little bit back and forth, right? Depending on prevalence of COVID in the community, and then how people are feeling about the safety of open reservations versus a defined set of folks who I see all the time. I see this in my kids' schools where they're talking about having cohorts and pods of kids who kind of follow each other all day long to reduce the amount of mixing here. And so, okay, great. Well, appreciate your insights there. Why don't we move on to summarize a little bit here. You know, so open reservations process, well suited for a lot of teams that, you know, only need to occasionally be at the office, right? Or folks who don't want to, you know, like Colin mentioned, be there 5 days a week. They really only want to be there, you know, Monday, Tuesday, and maybe next week it'll be Thursday, Friday, depending on their schedule and their needs. And so, you know, having that flexibility can be really helpful. And then on the other hand, the cohort system, you know, much better for teams that are on a, you know, fixed schedule. They're regularly could be like your facilities team, your corp eng team, and so those folks, you know, can set up their schedule and know that, you know, they'll always be in Monday, Wednesday, Thursday, or something each week. And that a lot of companies are opting for a mixed model here, right? Depending on the team. So if you have folks who, you know, need to be in every day, fixed same schedule, they can be on the cohorts, and that's great for them. Yet potentially, you know, 70–80% of the company might just be on open reservations, right? And they just coming in, you know, voluntarily as needed. And so I do see, you know, foresee companies, you know, using both models and potentially evolving back and forth, just like Cass said, you know, over time, depending on, you know, conditions. Okay. All right, why don't we move on to the fourth topic here. All right, so we are going to talk a little bit about dealing with complications of public transit and tight elevators. All right, so, you know, a little context here. You know, if you're in a dense urban area, you know, public transit is the norm, right? Which conjures up, at least for me, images of packed subways, packed buses, loaded elevators. And, you know, it can seem hard to imagine that employees are going to feel, you know, very comfortable commuting via public transit and squeezing into an elevator and working closely alongside colleagues doing the same. So, you know, really curious to hear, you know, kind of, you know, from, you know, folks who are dealing with this, like, how are your teams, you know, kind of coping with these commuting concerns? And I'm going to start off with Cassie, since I know New York City, you know, kind of all these definitely apply here.
Yeah, I think we were very concerned about this. This was the #1 topic that was raised in our return to work survey both times. And so in discussions with employees and amongst our leadership team, we had proposed a number of different scenarios. One being, you know, we'll have a small group of people come back, we'll monitor what the elevators and the lobbies look like. Because there's only a period of time that people can wait out on the street until it's either too hot or too cold in New York. Our building, and actually from what I've seen in the surrounding area, we're right in Midtown, has very few people coming in. I have not shared an elevator, although today I will say there were 2 other people close to the elevator when I walked in, and I just let them go up and then I got the next one. But we haven't had any elevator crowding issues. Our building has told us there is no other company that is quote unquote open, although you'll see a few people coming in every day. So far we've avoided that. We are monitoring it very closely. We've also kept open lines of communication with the building to let us know when they're hearing are more companies coming back. Do we actually need to start some kind of rolling schedule where we have some people coming in at 8 o'clock, some maybe at 9, and then we skip until, you know, 10:30 or 11, and doing some kind of shift structure to make sure that our employees can avoid the heavy usage times. When it comes to public transportation, I do know from early conversations with people in New York that there were some compliance issues with face masks. Then New York has done a big cleaning push, and they are purporting, although they are the ones purporting this information, that most people adhere to wearing masks on the subway. We've asked all of our employees not to ride public transportation on their way to work, and they are taking their own cars, driving in. There's a lot of parking right around here. We have people that are taking Ubers, riding their bikes. And because we have a small number of individuals coming in at this point, we are reimbursing for any commuting costs. Now, that'll be something that we also continually monitor, because as more people come in, it does get more challenging to reimburse all of that travel. But we want to make sure we're limiting both the employees' exposure coming in, and then if they had taken public transportation, they're potentially exposing, you know, employees in the office. And so by having private transportation it is mitigating risk for us, and we think it's worth it. So we'll be continuing to do that for as long as possible.
Wow, that's very, yeah, very, very interesting to hear, like the reality of what you're seeing on the ground there in terms of elevator, kind of usage, as well as, in the public transit systems being a lot, less dense than what, your typical, like, hey, this is what I think of when I think of New York City subways. So, all right, thank you, Kath. Yeah, curious, Ben, Roblox, what type of issues have you been seeing, and how have your team's been handling it?
Yeah, so in regards to public transportation, luckily for us, all of our employees who have so far utilized the office workspace kind of commuted using their own personal vehicles. So luckily, we didn't have to necessarily address that issue. When we reached out to employees who previously used public transportation, a lot of them kind of gave us feedback saying, the reason why we're not showing interest is because we're not fully comfortable yet, right? So there's that question of sanitation, there's that question of, kind of, hey, occupancy for a bus or for a train. So in regards to shared office spaces, though, such as an elevator, we really partnered with our contractors, so janitorial staff, to increase sanitation of these common areas. So really throughout the day, we actually sanitize it 4 times a day, kind of offer that limited density to 2 people per elevator ride. So luckily for us, Roblox sits on the 2nd and 3rd floor, and no other tenants actually are on those floors. So luckily, we could really monitor who's going in and out of the elevators. And really encouraging employees to take the stairs, right? When there's a lot of people lining up for the elevators, there's access to the stairs or alternative ways to get there. Masks are required to be worn in all common areas, whether that's an elevator or, walking through the lobby. And we actually assigned everyone into their own specific meeting room. So when they sign up for saying, hey, I want to go to the office Monday, Wednesday, Friday, we don't let them work off of their desk. We actually have the footprint. So luckily we have the office footprint to assign everyone into an office room. So, it kind of worked out in our favor in that regard. So thank you, Rowan.
Very interesting. Yeah, this, all the things that you have to think through, to bring someone back to office, not only how they get there, but where they're going to sit once they're back in office is, a huge logistical puzzle.
Hey, Rowan, I'll just add real quick, because we're on the 1st floor, so we don't have to worry about the elevator, fortunately. But I would say the commute was definitely a reason why people chose not to come, and they would just say, hey, I thought the commute was going to be a lot shorter than it was. And so I think it's just something to be mindful, regardless of whether it's public transportation or they're taking a bike or walk or driving themselves. I think that is a consideration that impacts people's decision to actually return. Why spend the 45 minutes of daily commute when I can just be as productive at home?
Right. Sometimes that 45 minutes is each way, right? So it really does actually add up on the workload. All right, so why don't we summarize a little bit here, right? What we heard is that, public transit ridership still oftentimes, far below pre-COVID levels. And so that can provide space for distancing, but, really that still creates exposure. And so you may want to consider reimbursing, folks to really take Uber or other, means of transportation in. Compliance with use of face masks, is pretty high in general right now, right? Some of it's self-reported, and so folks really would need to kind of see for themselves and get comfortable with it. But companies and office buildings, everybody is increasing their sanitation, right, of vehicles and elevators, and so in combination with low density usage and staggered schedules, right, that may help really limit your exposure risk. But definitely you need to really get a sense from your employees. How comfortable do they feel about this, right? And it's not just about their own personal comfort, but how comfortable do their colleagues feel about these same issues as you think about bringing folks back. All right, let's go to the next slide. Last topic area, lesson number 5. So this is really asking a question of how do you help your teams come to terms, right, with the very different in-office dynamics that they're going to find upon returning to the office here. And so just, context, right, like as an employee, I remember an office that was full of life, right? Socializing with colleagues, we're hunkering down and really, powering through, tackling, problems together. We're surrounded by, drinks, snacks, food galore, right? And unfortunately, many of these aspects will be dramatically different upon any near-term return to the workplace. And so, I'm going to put this question out there to the panel of, what's felt different and what's been more normal? And maybe we'll start with you, Ben.
Thanks, Roland. I totally agree with you, Roland, 100%. Our offices were so full of life, right? Coming from a company before COVID, where it was 90 to 95% based off of our San Mateo headquarters, that meant like it was completely stripped, right? And we have an issue of culture, right? And community, and everything here at Roblox is very community driven. So people thrive on those face-to-face interactions and in-person office dynamics. So, we found that, people who were going into the offices, right, sometimes their team was readily available, right? So we really had to push back and say, even if your team is on site, please stay in your assigned meeting room and utilize Zoom technology as much as possible, or video conferencing, even if your team is there. I think human tendency, especially if you haven't seen each other for months, right? It's like catching up, small talk, what's going on, what's new. But we really had to make it clear to them that this was more of a kind of WeWork setup, right? You go in, you're assigned a room, and there's really a limited social interaction all throughout. And really here, we also kind of had to address the issue of foods and drinks, right? Like Roland mentioned, we offered free food, free snacks. And now we're telling employees, right, unfortunately, they have limited to no access to shared kitchen appliances, right, because of the cross-contamination. So we strongly encourage employees to bring their own food. And really here, that was a huge culture shift, right? So right now we're partnering with our local cafeteria to kind of explore the opportunity for prepackaged foods or takeout, and kind of offer that to our employees and kind of redefine and revive some of that culture that we lost because of COVID. And really the most crucial takeaway for us that we learned was that it's absolutely critical to be proactive, right, in managing that employee expectation and letting them know what's off and on, and within guidelines. Because a lot of employees, like I mentioned, they missed working with their coworkers face to face. So they do have a tendency to break social distancing norms. I currently reside in Alameda County, and Alameda County does offer some sort of social distancing, kind of social bubbles, if you will, where you get into like potentially groups of 10 to 12, where, you could potentially hang out with that specific group and break social norms. But that's something that's very difficult to implement at a corporate company level, right? So we really had to remind them, that's unfortunately off limits until we hear, more of, how we could tackle this in the future.
Great, thanks, Ben, for sharing that. And it's almost a little sad, right? Like I think about this of, all right, you go back, and if you're really expecting that old office, you're faced with a new office, right? Like you just want to help employees not face that, sudden disappointment when they get there. Let me turn this over to Colin. Thoughts from your end. I know your team, smaller team, but more spread out. I'm curious, how are you thinking about this?
Yeah, I think it's those employees that were very enthusiastic to get back into the office. I think they were just so appreciative to, at least in the beginning, to be there and to socially distance, say hello. And, there was an elbow bump or two that definitely happened. But I would say that the thing that we have not figured out is the whole dynamic between the in-office team and the remote team. And how do you navigate that, the communication? Because when we're all on the same Zoom meeting together, free-flowing communication is not a problem. But when you're in that office environment and the majority of your team is remote and you're sitting in an environment next to people that are not remote, it's just a little bit different in terms of that sort of the ease of the communication. Inter-office communication was great. The challenge that we still haven't worked ourselves through is those that are in the office communicating with those that are not. I think the other thing that I would just say is those people that are not in the office that have expressed a desire that they don't want to return because of their discomfort level, they are hypersensitive about what's actually happening in the office. And so you really have to be mindful that everything that you say you're going to do in terms of keeping that office environment safe and secure and the like is actually happening and occurring because everybody is watching what's happening there.
Yeah. Great, Cass, similar, kind of themes that you're seeing?
Yeah, I would say one thing that Ben had talked about earlier is on top of having mixed remote and in-office teams, for those people that have chosen not to come in or can't come into the office, I've heard conversations of people feeling nervous. Is this going to impact my ability to work on a project or to have a promotion? Because even though returning is voluntary, is it really voluntary if my leader is in the office? And we do have most of our leaders in the office. And the other piece to what Colin was just talking about is the dynamic of, we'll have 3 of our senior leaders here during our staff call, and we'll have 3 or 4 that are, doing it via Teams. And there are conversations that happen before you hit, join on Zoom, and that happen after you end. And people end up feeling like they've missed part of it. And sometimes there are actually pieces that you need to remind yourself to convey because a conversation will continue after a meeting has ended. And appreciating all of those dynamics and making sure people are aware and that there's enough communication going on is key. One thing that struck me as an interesting aspect of people coming back to the office is, and I found this true for myself, if you have a particularly frustrating day or something goes wrong and you're sitting at home, it's very easy to get inside your own head and think about it and overthink about it and sort of try to put yourself in somebody else's shoes, but maybe it ends up becoming a much bigger deal than it needs to. And so when you're in the office and you're able to talk to that person face to face, that is incredibly helpful. Or the other nice thing is you take yourself out of your home space where you are before you start work, all day during work, and then after work. And it really does help with a mindset shift just to allow you to get out of that pattern of continuously thinking about one item and not being able to sort of separate the aspects of your life, which is important in this time because they're flowing together more than they used to.
Absolutely. All right. Well, I think, let's summarize here a little bit of kind of what we heard. So, offices sounds like they will generally continue to be sparsely occupied, right? Between distancing rules and folks, opting to continue to work from home. And then the office environment is going to be different, right? Some places will, and some folks will be wearing masks in the office, you don't have these communal lunches and drinks anymore. And then probably reduce willingness to socialize, versus how things used to be, right? So things will feel very different. So I think the key, takeaway here is really, making sure to help guide your employees to, kind of understanding that so that when they walk in, they already know what to expect here. All right. So I think, let's see, we have time for probably like maybe 1 or 2 questions here from the audience. We'll summarize the top lessons. Let me do this top 5 lessons learned. We'll go to QA after that. So first, not everyone who expresses interest will show up upon reopening the office. Number 2, provide your employees with clear guidance on COVID testing locations and how it may interact with their health insurance. Lesson number 3, a lot of companies are using a mix of open reservations and cohort system. Lesson number 4, public transit and elevators are exposure risks. But the risk may be manageable under certain conditions. And then last, lesson number 5 is, proactively manage your employee expectations around, the office environment, what that will look like when they come back, because it will feel very different. All right. So I do think we have like a minute or 2 for a couple questions here from the audience. I'll open up to the panel, just you can jump in if you, your thoughts here. So first one is, how do we ensure that our policies are compliant and we're abiding by the changing state and federal regulations as things keep continuing to evolve in this situation?
We actually had external counsel review them. I know that's sort of the easy answer, but they are changing and evolving so quickly. And I know in New York, we're trying to abide by New York State, New York City, New Jersey, Connecticut, because we have employees in all those states. And so using outside counsel was really the best bet for us.
Ben or Colin, any thoughts from your ends there?
I just, dedicated internal resource. That's what living and breathing everything that's going on, and working in conjunction with you all at Sequoia has been how we've been navigating it.
Okay.
Yeah,
Excellent.
same here. It was a combination of outside counsel and our internal counsel. And also in the very beginning, Sequoia connected us with 650 to kind of initiate that process of that policy review. So it was really great.
Great. And then we'll take one last question here. Is it mandatory for employees to get tested prior to coming back to the office, where you're located? And if not, what are some of the considerations towards making the decision of, requiring testing or not requiring testing?
So we required testing just because we wanted to make sure and reiterate sort of our focus on safety of our team. And so just giving that peace of mind for everybody. It's not a perfect, fit, because obviously they can, and the time they come from the office to going home and the intermittents between they're getting tested, they certainly can get exposed. But we definitely made it a requirement, and I expect we will continue to do that for the foreseeable future.
It's not required in New York City or New York State either, but we do require it. Same reason as what Colin had mentioned, which is we want to mitigate the risk as much as possible. And especially given the densely packed area of New York, whether people are going to a grocery store or eating outside or just walking into an apartment building, there's a lot of opportunity to have exposure, especially with the number of parents that we have too, children going to nannies or daycare. And so we felt that testing on a regular basis was really important for us.
Yeah, and to go off of that, what Cass said, in terms of frequency, something that we explored, we kind of asked ourselves, should this be a bi-weekly or a monthly kind of frequency for testing requirement? And we landed on monthly, but we still, go back and forth, right? Sometimes, it's only as accurate, like Colin said, it's only as accurate as it's, as when it was taken. So definitely something that I think everyone needs to keep top of mind during this time.
Great. Well, thank you all. This wraps up our panelist segment. So thank you, Colin, Cass, and Ben for joining us today. It was really enlightening to hear you all talk about what you've really seen and learned from bringing your teams back to the office. So thank you so much for sharing, and back to you, McKelly.
Thank you, Roland, and thank you guys. That was excellent. Really appreciate that. So Roland, real quick, so we're lucky. We get to stand up here in these webinars and talk to smart clients and put up the shiny slides, but behind you and behind us, there's a team working hard at Sequoia, our folks in India, our folks out here in the West Coast working on the software, working with clients, taking the feedback, putting it in. Just take a minute and maybe share some of the key themes that we're focusing on right now with the Return to Work Center, and just kind of get everyone up to speed on where the product is going.
Yeah, sure. That sounds good. Happy to do it. So our Return to Work Center, in August, we had a big release of V2 where really focused on the open reservations process to support ad hoc office visits. And so that's, added on to our original cohorts process. And so that really built out this flexible system that companies can use depending on their situation, and mix and match between the two. Where we're going, moving forward, as people know, the platform already supports policy creation, management of cohorts and reservations, and reporting and tracking. And then, I think McKelly mentioned that we have demo sessions every Monday and Tuesday. But what we're working on next for the platform is really to address the difficulties around, getting testing done that, was talked about and touched on in the roundtable today. Right now, it can take several days to schedule a test and several more days to get the results back, which is a long time if you have a sick employee and are trying to determine how long, do I need to quarantine an entire team or even entire office, right? And so, Sequoia, we're working to put together some partnerships with lab vendors who can offer, both at-home and in-office test kits that can be ordered directly from within the platform, test results available the next day after submission, and then all that directly integrated into the Return to Work Center for streamlined management. So imagine an employee, reports they have COVID-like symptoms, right? From the platform, you can go ahead, order a test kit, deliver it to the employee overnight. That employee does the test at home the same day, sends it in, and the results come back the next afternoon, right? And then based on that, you can immediately and confidently tell, the other employees whether they need to continue quarantine and get tested or not, right? And all that happens within 72 hours, right? Instead of the current, almost week plus timeline that happens. And so that's the level of agility that, we need in these times. And so that's what, the team here at Sequoia is working on to continue to enhance this platform as we go forward and to make it, more and more kind of comprehensive for all of our clients and partners.
That's great. Thank you, Roland. Just in closing, again, I want to echo Roland's thank you. Colin, Cass, Ben, you added so much color and insight, and thank you for sharing your experiences so articulately and helping a lot of people who are, right in your shoes right now, or maybe where your shoes were 2 months ago, 5 months ago. So it's really cool. I appreciate it. It's a big part of the Sequoia way is to, of course, bring the voice of the client into the discussion and really unlock the value of the community. You guys performed admirably. So thank you, and thank you for your time on that. And then Roland, I want to personally thank you for your leadership on this program. Sequoia is chock full of really smart, wonderful people, and some of the best are on the Return to Work program. And so thank you to your team, the folks on the implementation side, the software side, as I said, and really the client service managers and everyone else who's kind of rallied behind this product. It's really cool to see where it's at. So thank you for your time today and your great moderation. You're going to put me out of a job, man. That was looked too comfortable for you. Anyway, in closing, thank you guys for being here today. Hope you enjoyed it. If you have any additional questions, go ahead and put them in the Q&A, and we look forward to connecting with you again soon on our next webinar on the Return to Work, the path forward. Be well, take care. We'll talk to you soon.